Welcome to Al Hakam Inspire. Today's guest is Dr. Musa Sami, who is a clinical associate professor of psychiatry and consultant psychiatrist working at the University of Nottingham in the UK. He has a particular interest in the overlap between substance use issues and addictive disorders and works both as a clinician and researcher in the field. Dr. Musa, it's a pleasure to be with you today.
Thank you very much.
As a disclaimer, for specific medical advice, please contact your medical practitioner or doctor. Al Hakam Inspire does not advise the implementation of any specific conclusion from today's episode. During the podcast, we present ideas and research on the topic and surrounding areas. The aim of the podcast is to provide an enjoyable experience of knowledge acquisition, exploring current research and future ideas, and reflecting on the spiritual and Islamic traditions where applicable. So, Musa, can you tell us a bit about yourself, about how you got into research and what areas of research that you're looking into at the moment?
Yeah, well, I started off becoming a doctor, and I didn't want to be a doctor. It's a very long story that happens in many Asian families, right? But as a Muslim, obviously, one should try and do the best one can with one's life, right? So I accepted to be a doctor. Then I didn't know what to do. I undertook various kind of medical specialties. I thought of going into hospital medicine at one point. I kind of got drawn back into psychiatry. I'd worked there as a medical student on the wards. And my mother was also a psychiatrist, so I kind of found that pull. And then as I became kind of more and more into clinical working and seeing patients who had really sick, serious kind of mental health issues and problems, and there's when you see some of our patients, they've really been let down by society, and so it kind of got me interested into what are the causes for this, what are the kind of reasons underlying all of this, and how can we look at bettering outcomes for the people in our society. Now the thing is that some of these questions are really, really complex, and we can talk about them later. There's questions about our genetics, about our lifetime experiences, about traumas we've gone through previously, and some of them are so self-evident that we just forget how large a problem they represent, right? So for example, substance misuse issues crop up again and again when we're talking about mental health. Now the relationship between them is not simple, it's quite complex. We can discuss that in a moment. But what I found really, really interesting, and I still find really interesting, is how chemicals, essentially, which is what substances that we take are, affect our kind of brain, affect our behavior, and affect our outcome in life. It tells us something about the chemical nature, the fragile nature for me of ourselves, right? And so this is what I've really been looking at in my research, and particularly I'm interested in those kind of relationships, cannabis and psychosis, alcohol and depression, and there's a lot more that comes with that. But that's where I've been going, I suppose.
Sure. I mean, that's incredibly interesting, and I think we'll come on to the aspect of chemicals and neurochemistry, how that affects your brain. But for the average individual who doesn't understand what addiction is, could you summarize or perhaps give us examples of different types of addiction that are troublesome for people today?
Okay, sure. So addiction is sometimes a somewhat overused term, right? So let's just start off with the very, very basics. Addiction is the compulsive use of a substance or the compulsive engagement of a behavior which is harmful for you, right? What I mean by compulsive is you lack a certain control over it, right? So this is one of the best questions that I ask one of my patients with a sort of an alcohol addiction, for example. Who has control? Is it you or the drink? Right. And if they say, I mean, this is just such a great question for me in the clinic, right? If they say, it's the drink. It's the drink, doc. The drink has got control. It's not me. Once I start, I can't stop. I know pretty much. I can ask lots of other questions, but there is an addiction issue here, right? So it's compulsive. You lack certain control over it. You can avoid it, but you find yourself drawn back to it, right? And that loss of control is extremely important. The other thing is that it has to be harmful, right? So, some addictions that we know very well about, right? So, for example, smoking or tobacco addiction, or alcohol addiction, we know that they're harmful. Now, it doesn't just have to be a substance. Often it is a substance or a chemical that we take in. It can be a behavior as well. The most well-known behavioral addiction is gambling, right? More recently, there's a lot, in the with going with the times, I suppose, available internet use. Pornography is being more recognized as an addiction. Yeah. It can be a substance, it can be a behavior. There are other kind of addictions that people talk about, right? So people will talk about, work addiction, exercise addiction,
food addiction,
food addiction, and shopping addiction. Now, these kind of addictions, firstly, they're behavioral addictions, and although I accept that you can be addicted to these things, I think the term in that sense is overused. Addiction, you have to remember, it's a serious mental disorder. It's a very, it causes a large disturbance in your life. If you overspend, £300-400 on some clothes, if I'm talking about some richer people, who are into fashion, that's not necessarily an addiction. That's something that you may wish to cut back on. But I think addiction has to be compulsive, and it has to be harmful, and you have to know of the harm as well, right? So some people may not know about the harm and continue to do something harmful. That wouldn't really qualify as an addiction.
So just to come off that, so if someone needs to know that it's harmful for it to qualify as an addiction, like what if someone is, for example, addicted to alcohol, but they don't know it's harming? I mean, I just want to understand this aspect of that. They have to be cognizant.
So I suppose you can say that there are some individuals who do not realize the extent of their addiction.
Oh, okay.
But they would realize that too much alcohol use will cause harm, or is causing harm in different aspects of their life. Often, what I see actually are people who have kind of compartmentalized their life. So they have had these, car accidents from drink driving, or these drinking brawls, but they haven't all kind of brought it together to realize the overall effect that it's having.
Right. Just to kind of move on from this, then, there's all sorts of addictions like you're talking about, behavioral addictions, substance use. What's happening in the brain? What's the mechanisms, the neuromechanisms happening? And also, if you could talk about, especially in this day and age, there's this huge hype around dopamine, and what is this molecule in the brain? What does it do? So what happens in the brain when someone's addicted to something?
Okay, so let me first just very simply explain the brain in a very simple kind of terminology.
Yeah, that'd be great.
Yeah. So just imagine the brain as being this huge kind of this huge network of wires, control systems, and switches, right? Okay. And so the thing is, it's extremely densely interconnected, the brain, right? And the thing which runs the brain essentially are these switches, which you can switch on and off, which are essentially called neurotransmitters. So they're chemicals, right? So dopamine is a neurotransmitter, right?
Okay.
And essentially, if you switch it on, lots of things happen in the brain, and all of these switches, have their appropriate time and place to be used, right? So, for example, then there's many different neurotransmitters, but dopamine is a very common one that we know about. For example, dopamine helps us capture our attention. So if something new happens, I kind of get a dopamine hit, which catches my attention. So, for example, just extending a gambling metaphor, right? I am putting, coins in the slot machine, right? And all of a sudden I hear that ping and, a whole load of coins come out, right? And so, my dopamine is telling me, it's released and is telling me that this is a good thing and I want this back, right? So in that way, dopamine is also involved in learning, and we use it all the time. So if you work very hard and you pass an exam and you do very, very well, you get your marks back. You get 97%, whatever. You'll get that dopamine surge. Dopamine is a completely normal brain chemical. It's extremely important, right? So what happens essentially in addiction is that so I suppose what I'm trying to get across is that reward and learning are linked, and they have to be for our normal everyday to-day life, for us to learn anything, for us to gain new experiences, right? And dopamine is the conduit to that. What happens when we take drugs, for example, cocaine? Cocaine directly increases the dopamine level, right? You get that hit without having to do all of the kind of work.
Hard work.
Yeah. So, or many other drugs cause the same thing. They cause this massive dopamine hit, right?
And how massive? What's the difference? If, for example, cocaine, let's take cocaine. If I finish a run and I get a good dopamine hit, how much are we talking about if someone is addicted to cocaine? How much higher is their base level?
So it has been quantified. I don't have the figures to hand, but it's very substantial, And so I mean it's several fold higher. I think one could say, right? And so what happens is that kind of hit, we seek it again, again and again, because that's our learning mechanism. So what I'm trying to say is that addiction is a hijacking of the reward pathway, and it's what we would call a maladaptive kind of learning strategy, right? Now, the other thing that happens in addiction, as you may know, is that the situation changes over time, right? So when I speak to young men who smoke cannabis, for example, the first time they used weed, they will talk. It'll cause a very different, response to kind of the more recent time that they're using it. And this happens with all drugs. And what generally happens is we go from, at the start, what's called an impulsive type of use, right? To a compulsive type of use. That what's happening in the brain is that behavior is becoming hardwired into our brain, right?
So how is that? Because you've explained about the dopamine pathway, but is something changing there in the reward pathway or the learning pathway?
Yeah, so there are some, I told you about these kind of control systems in the brain, right? So there are some control systems situated very deep in the brain called the basal ganglia, and it move. The dopamine hits start off, attacking kind of or activating at the front of that, and as time goes on, it's kind of brought further back and coded deeper into the brain. So these are the current models that we understand now. I'll just say one thing about brain biology, because if you Google this or if you look this up, there'll be lots of pretty pictures of how addiction works, right?
Yeah.
Listen, we can't actually put pins in the brain and, measure chemicals in the same way that we do in rats, and we can do some scans, right? But it won't tell us exactly what is going on. So what we've done is we have developed some models, right? From some evidence in humans from certain scans, and some from kind of rat-based behavior. Rat models are kind of, the models that we tend to use. And that's how we've come up with these models. It may be that, these models are not completely the truth, or that, there's further advancement in our understanding. But I think the fact that dopamine is evolved, the fact that there's a hijacking of reward-based pathways and learning, I think these things are pretty well known.
So if we just come on to the we've talked about the neurochemistry. If we just come on to the individual themselves, at what point would they recognize, or would they begin to understand that, look, I have an addiction, or this has become a problem, this has become more than a habit, it's taking over my life and it's causing damage?
Okay, yeah, this is a really interesting question, right? And so I think I told you about that question, that you should ask yourself about anything, I think gamers should ask themselves about computer games as well, who has control? Is it me or the game, right? But okay, let me just tell you a bit about the history of addiction as a concept, yeah? So in around, I think, 1976 or around that time, two researchers who were looking at alcoholism, they were called Edwards and Gross. They were, fantastic researchers, seminal researchers for our time, right? They wrote a paper. I think the paper is called The Provisional Criteria of Alcohol Dependent Syndrome, right? So I'm just emphasizing the fact that they said that, well, we think these are the key things that we should be looking for, but it's provisional and we haven't kind of got it completely down to a T yet. But, those criteria now come up again and again in all of the textbooks, in my kind of psychiatric manuals and many others, right? So I'll tell you about those. And a person should ask themselves whether they're experiencing these things, right? You don't have to experience all of them to have an addiction, right? But if you have, many of them, then you can begin to start thinking that, look, this is becoming a problem here, right? So one of the things they noticed was something called narrowing of the repertoire. So this is something I see in people who drink alcohol. So the narrowing of the repertoire means that instead of drinking, I don't know, brandy and shandy and wine and champagne and all these other kind of things that, people who enjoy alcohol drink, people go to, the hardest stuff they can find, and they prefer that, which is normally in this country, what I see is vodka or gin. Yeah. So their interest restricts as well, right? Maybe you can see this in computer games as well, right? There's one particular game that people restrict to, right? Because it gives them the best hit. Yeah. Another thing was called the salience of drinking. So this is where it starts taking priority over your day-to-day life, right? So so for example, sometimes I see people, the drinking is more important than getting food. It's more important than getting the heating on. It becomes sometimes more important than having relationships with your children, because it just becomes an increasing priority. Another thing,
it just takes over their life.
Everything. Yeah, absolutely. And it psychologically it takes over their life as well.
Wow.
And another thing which they noticed was something called increased tolerance. So you need to drink more and more to get the same hit. And actually, sometimes when I'm seeing patients, they tell me that actually I don't get a hit anymore. It doesn't matter how much I drink. I suppose I see people, at the very severe end of the spectrum, right?
Does that mean that dopamine it's I don't know, it's gone numb, or it's reached a level where they just can't get to that threshold anymore?
Yeah, and so there's very complex biology going on there, but I think one of the things that you're saying is probably right. So the brain rewires; it's always rewiring, and the switches are always readapting themselves as well, right? So
the brain does change.
It does.
During this. Okay.
Yeah. It changes. The brain changes all the time. Our brains are changing right now, right? The brain is a beautiful organ, and so that is one of the things that you don't get that same hit, and that's because of what we would call neuroplastic change. There's other things going on in the body as well. The brain is not the only beautiful organ in the body. So the liver starts adapting to the amount of alcohol that you're taking in, and it starts kind of flushing it out or metabolizing it much more, right? Yeah. So the other thing I think that maybe you're aware of, many people are, is people start getting withdrawal symptoms. So if they don't drink, they start getting the shakes. In severe cases, they can have seizures, fits, hallucinations. And then when they do drink, after experiencing some of those withdrawal symptoms, they they've experienced relief, right? And then there's a couple of other things, that you begin to understand that you need to drink, and the other
What
thing.
are sorry, Dr. Musa, what are the you're talking about withdrawal symptoms as well? Why, if something's happening in the brain, why do people start shaking? What's the effect happening there? Or they start
Okay.
having
The
different
the,
effects on their body?
the
Yes.
withdrawal aspect, isn't it?
Yeah.
Yeah. So that's related. So alcohol is a particular switch in the brain. Alcohol, acts on a particular switch called the GABA system, which is
Okay.
thought to be the brake on the brain, right?
Right.
Okay. So as you drink more and more alcohol, right, your kind of your what's it called, breaking point lifts, as it were. The brain adapts, right? Okay. Now you take away the alcohol, and all you've got is excitation. And that's what you see in alcohol withdrawal, right? Where people have seizures, where people feel more anxious, where their heart rate goes. This is all controlled by the brain, right? So I mean, these chemicals can be, dangerous when you're addicted to them, right?
Let me just jump in there, Dr. Musa. So this is sort of in relation to alcohol and substance misuse. So in other words, we've seen that those individuals suffering with drug addictions, they often end up, for example, people suffering with heroin addictions end up on methadone prescriptions. So they give them a sort of a small sort of hit for them to keep them satisfied. What about things like behavioral addictions and things like pornography or food addictions? How can someone manage that aspect? Are there any therapies available? Are there any strategies that people can use?
Well, yeah, I think the first thing that's important is recognition, right? And the second thing is that essentially what's happening is that the addiction is taking over your life, right? So you need to refine some kind of meaning in your life, right, to overcome the addiction. Now, the different people find that in different ways, So for some people, it's, for example, exercise. And for some people, it's kind of thinking through their problems through a kind of what we might call a mindfulness based approach, right? And for some people, you kind of engage that by what we call motivational interviewing. So this is a kind of non-judgmental interviewing, which I might have with a patient, where I'm kind of gently challenging them, but not quite confronting them, and looking at just looking at the resistances and gently pointing it out to them, right? There's but I mean, as we've talked about, it's the if the addiction has really taken over, it's a real concerted effort to overcome addiction. Now, most people with addiction, any addiction, get over it. It takes time, so there should always be hope, and some people go through a very rough time in overcoming that addiction. But with I think the one thing I find, I don't know if you'll find this in an academic paper or something, but if you look for the dignity of the individual in front of you, and you find that, and they find that for themselves, that's when um that's when people can have a good prognosis, right? For some
So
people it's family, for some people it's religion, it's various other things. Yeah.
does that mean in your clinical work you connect with that person at very deep levels?
Yeah,
And
I think so. I think you have to,
mhm,
I think the most devastating addiction in this country at the moment, that people may argue about it, I think it's alcohol addiction.
right.
I see people who have really sometimes hit rock bottom. Not all of my patients, but many of them. And everything's been taken away from them.
Yeah.
You've got to, and sometimes that becomes a cycle of drinking, a reason to drink, right? I don't have
Right.
anything,
It's a
I've
vicious
just got the
cycle.
drink. Yeah, yeah. So
Yeah.
you've got to find the dignity in them and give them their dignity back, right? And that kind of connection can only happen once you look for it, right?
You spoke about dignity, and I just want to ask the question, as Ahmadi Muslim researcher. You've gone, you've read the Quran, you follow Islamic principles, you've read ahadith, the sayings of the Prophet Muhammad, may peace be upon him. Have there been any links where you've seen, for example, something come up in research papers or some advice which is being given out to psychiatrists in treating patients? But have you seen, from an Islamic perspective, some maybe practices that we as Muslims do that actually would help someone with addictions or with avoiding addictions, for that matter?
Yeah, so that's a very interesting question, because obviously I was Muslim before I was a psychiatrist, and so the thing is, the Quran talks, as we know, about alcohol, and it doesn't just talk about alcohol. It talks about something called khamar, which is broadly translated as intoxicants, and it talks about them in 2 or 3 different places. And for me as a Muslim personally, I have to say is what the Quran actually says is very profound, right? Yeah. Let me just explain a couple of things. There's been a debate in, say, just with alcohol addiction, but any addiction, whether you want to use a medical model or a moral model to treat addiction, And I think what most people have now come to is that, there is a benefit, of course, in having a medical model, right?
Yeah.
And there's a benefit in not moralizing, right? But there is a moral aspect to addictive disorders. So there needs to be some degree of willpower, in order to overcome that. If you just say this is an illness like a broken leg, it's not quite that simple, right? So the Quran clearly gives a very moral view, right? And actually what it says, we can go through the verses as well, but it actually says that the best thing to do to avoid this is to avoid it completely and essentially not to start. And I think that is actually, that has probably saved the Muslim world. I'm not saying that no Muslims drink, right? Because many do. Many of them are my patients, right? But it has saved a huge amount of problems for in the Muslim world, and I mean this is well attested to.
Exactly, it's a no-go area, right? It's just from birth, as a child, that it's just something that you shouldn't go, and it's prohibited. There's no leeway in that.
So if I think about, some of my patients who may not be Muslims, they may have had their first drink at the age of 14 or 15. That's not uncommon in this country, right?
Yeah.
And then they may have had some very traumatic experiences growing up, right? At that time, they turn to alcohol, right?
Mm-hmm.
And they're in order to help them cope, and Muslims who have not ever drunk, they wouldn't think about turning to alcohol in the way to help them cope. And therefore, although only a small proportion of people in this country may develop an alcohol problem, overall it's a very large proportion of people that are affecting our kind of hospitals and how are having a really torrid time in life. So one of the things is, I think that the Quran talks about is abstinence. It doesn't talk about moderate drinking. This is another debate, right? That should you have moderate drinking or should you abstain, right? So in Islam, now look, I never obviously use my religious principles or enforce them on others, and I'll have that open conversation with people when they're my patient.
Sure.
But I think that take somebody who has developed an alcohol problem, right? The best treatment, I think the science is showing this more or less, right, is not to kind of go. So many patients will say, I want to aim for, I do want to drink, I just don't want to drink this much.
Okay.
That kind of doesn't make sense when I've told you at the beginning, that alcohol, the addiction is about a lack of control, right? So the thing that you need to do is actually stop. That's probably got the best outcome for you, right? And I mean, to be honest, if you read the Quran, that's what it kind of advises. Avoid this completely so that you may prosper.
So can we just clarify one thing here? So are we saying that if someone is addicted to alcohol, for example, the best thing for them is not to have it in small doses, but it's actually better to avoid it completely in order to treat their addiction?
I think in the long term, as a scientist, actually, that's what I would advise. In the short term, I don't advise people to stop drinking completely. I say that, there are risks of withdrawal seizures and other things. We need to think about either you reduce it slowly and then come off, or we bring you into a detox and bring you off that way. These are this group of drinkers that I see drink extremely heavily. So for the very heaviest drinkers, stopping straight away is problematic, right?
It,
But I think in the long term, they should look at avoiding drinking.
it's really interesting you say that about, just completely avoiding it,
Mm.
because I was listening to Dr. Anna Lemke from Stanford, who's chief of the Stanford Addiction Medical
Yeah.
Dual Diagnosis Clinic. And she was actually advising, and she said that through her patients, what they saw is that 4 weeks of abstinence, complete abstinence. She was saying exactly what you're saying, that it was the best thing to do was just completely avoid that habit or that substance. And within 4 weeks, they saw a huge change within, the response, the addiction intensity, if you like, of those patients, and they saw huge improvements. So it's really interesting you raise that point, because the Quran does say just don't go there, abstain from it. So
Yeah.
it's that's really interesting.
There's a couple of other things. I've always found it really interesting that we're now neurobiologically finding that, alcoholism and gambling, for example, they're related, and that there are similar areas in the brain which are involved. The Quran, it talks about the two together.
Together, exactly.
Yeah,
exactly.
So I find that fascinating.
That's probably, for all other Muslim researchers out there as well, and others, that's an area of research to go into. Why does the Quran mention gambling and alcohol together? And like you're saying, a lot of the mechanisms in the brain are involved with the same.
Yeah. So for me, I find my inspiration from the Quran in the research that I do, in the clinical work that I do. I think it's very important, as a medic and also as a scientist, not to stigmatize people, for the for the judgments or the choices that they've taken. So I try to very hard to avoid that.
Yeah.
But the Quran is very, for me, it's fascinating.
Fantastic. Now, before you touched upon willpower and having a motivation to actually bring yourself out of addiction. Fatih's just touched upon some evidence where a period of time of struggle is required or expected when trying to remove an addiction. Dr. Musa, what do you think about the aspect of the month of Ramadan in Islam? Ramadan is just around the corner in a few months' time. So just touching upon this, how important do you think that month will be for Muslims, and perhaps for those wanting to remove a habit or an addiction in itself? Do you have any comments about that?
Yeah, so Ramadan is very, I think it has a great role in this, So firstly, in the fasting period, Muslims abstain from that which is lawful, and there are certain addictions, I think, which are can be very well managed here, So for example, smoking is a very common problem in the Muslim world, as you may know, right? And so Muslims who fast, they abstain from the smoking for at least 12 hours, right? It can also be used to abstain from, the other addictions, for smaller periods of time, and then people can use it to, kind of use that for larger periods of time. It's also, of course, Ramadan has a great kind of spiritual connotations for people. So people use Ramadan for their spiritual development. So Ramadan can be used very well. I mean, it depends on the individual who's undertaking it. And of course, in Islam, fasts don't just have to be during Ramadan. We can fast outside, or we can take a period of fasting outside for that purpose as well. So, if a patient came to me and said, I want to use Ramadan or fasting for this purpose, I would encourage them in that. Having said that, if an individual is drinking extremely heavily, I advise them to focus on their nutrition first. I think that's important. Yeah.
Why do people fail when they want to stop addictions? Why is there the relapse? What things have you seen? What are they doing wrong?
Okay, so I think that one thing I think that's important. I tell my patients when they've achieved abstinence, I tell them all of this. Is something called the abstinence violation effect, right? I use those kind of fancy terms, but it's something that we all know about, right? This is the fact when we pledge that we're not going to do something, right? And then we do it, So a guy walks past a pub and then gets a pint and has what we would call a lapse, right? Because he's been triggered, he's seen the cues, and yeah. After that, the immediate milliseconds and seconds after that, he will feel rubbish, and then think, I'm going to have another one and another one and another, and that is what's called reinstatement after abstinence. That is actually one of the ways that addiction works, right?
So it's the cue that they see.
Well, it's the cue that pulls you, and then there is the bad feeling, the abstinence violation effect, right?
Right.
You violated abstinence, and so you feel rubbish. It's an extremely powerful way that a lapse turns into a relapse. It doesn't have to turn it. You could walk away at that moment, but it's kind of the brain has begun to be wired that way. If you understand that, it's easier for you to try and walk away, right? But it is tough, and that's why people will stumble, and you have to be ready for them to stumble and to help pick them up after they do.
So sorry, just realizing, I just want to kind of pack that into a few points. So realizing that there could be a relapse, and that that cue could make you take that drink again, for example, and that will cause you to feel very, very bad, and then you go down that vicious cycle again. Is that?
Yeah, that's right. So one of the you'll have heard of this, right? Is Alcoholics Anonymous. One of the best treatments to maintain sobriety or abstinence is Alcoholics Anonymous. I don't know if you know this. Alcoholics Anonymous is based upon 12 steps, 12 kind of principles. One of those principles is actually a religious principle, and alcohol, the belief in a higher power or a higher nature, and Alcoholics Anonymous was actually set up by a group of Christians, right? And it's, when you might have seen this in the movies, or you can go to Alcoholics Anonymous meetings. They happen all the time. They're open. I mean, I've been to some. People stand up and say, my name is John and I am an alcoholic, even if they haven't had a drink for 10, 15 years, right? Because they know that they could be pulled back very, very quickly, right? And so there's a kind of buddy system. It's an extremely effective way of working, 12-step program, but only for people who can get with the kind of program, who can accept the 12 steps. And sometimes, some of my patients turn around and say, well, Alcoholics Anonymous doesn't work for me. I can't get with the God bit. That's what they say. But
because they've never really experienced that angle. Is that why? Or
I think it. Yeah. Well,
it's hard to relate to that.
It is hard. I understand it's hard. On the other hand, I've also realized by treating people with alcohol addiction that, I don't know, belief in God, maybe this is slightly controversial. I don't think it's an all or nothing phenomenon. I don't think you either believe or you don't believe, because those people who say, I can't get with it, might come back to me 2-3 months later and say, Doc, I went, and suddenly they've changed their view, and I don't start probing people about what their religious beliefs are now, right? But when people really hit rock bottom, they often turn towards God. Or a higher power. It's not unusual. It's something you see very often.
Sure. So, I mean, Dr. Musa, we could speak to you for hours on this topic.
Yeah, I feel like I've got so many questions to ask.
Absolutely, it's absolutely fascinating. But I think just at the end, I just want to ask one question, where there have been studies where individuals who have been praying have undergone some sort of imaging, so functional MRI or scans at certain points in time. So, and it's found that those individuals who pray, it changes the brain in a particular way. So again, this aspect of neuroplasticity. So I suppose at the end, we just want to ask, how important do you think prayer can be in terms of changing that neurochemistry, in terms of helping someone with addiction? Is there any evidence for its use, or is there any benefit that you've seen from anecdotal sort of patients if they turn towards God, you found them dealing with their addiction better?
Well, yeah, I mean, I mean, it depends on, I think, the prayer, and it depends on the person who's offering the prayer as well, and their particular situations in life. I think, there are many stories, right, of people who have, found God or kind of found religion, and then managed to walk away from the kind of alcohol addictions. And we know this in the history of Islam, right? It's very famous, how the Quraysh gave up alcohol. And you hear these cases again and again. The thing about the biological effect of prayer, having an effect. Now, I know that prayer is a protective factor in depression. I haven't actually looked at prayer in addiction. I don't know if many studies have. Right. What I would say is that you have to realize that our brains are changing all the time. You give me that example of people having a scan from praying. They've also found that people who drive London taxi minicabs, that bits of their brains change as well, right? Because they learn about new routes and stuff. Our brains will always change. I would think it's probably less how the prayer changes our brain, but what we invest in our prayer that would make the difference, But
100%.
Amazing.
Dr. Musa, this has been brilliant, and I think me and Dr. Hisham would love to ask you loads of questions, but we definitely would be honored to have you back on the podcast, God willing, in the future. But thank you for joining us. It's been super interesting, and I'm sure that all our listeners have learned a great deal and also have taken tools back home with them as well, which they can implement in their daily lives. So thank you very much for being on the Al-Hakam Inspire podcast.
Thank you very much.
Jazakallah. Thank you for listening to the Al-Hakam Inspire podcast. We hope you enjoyed it. Visit our socials on Instagram, Twitter, and YouTube at Al-Hakam Inspire. And of course, subscribe to our YouTube channel and leave your comments there. We would love to hear your feedback and thoughts, so send us an email to inspire@alhakam.org.